Hello guys, welcome to Healthcare Engineering YouTube channel. On our channel we share many informative videos all about healthcare industry. Subscribe to our channel to keep yourself updated. Also share videos and channel with all the healthcare contacts. Like our videos and let us know your valuable comments to show us your support. Today we are going to share you some useful information. It should be known by all healthcare professionals. Stay tuned with us, subscribing our channel to get the all notification. Now let's go through all about type of disease. Acute lower respiratory tract infection. Acute lower respiratory infection include pneumonia as well as infection affecting the airways such as acute bronchitis and bronchiolitis, influenza and whooping cough. They are a leading cause of illness and death in children and adults across the world. What is the best treatment for lower respiratory tract infection? Tetracycline and amoxicillin are first choice antibiotics. In case of hypersensitivity, new macrolides such as azithromycin, roxithromycin, or clarithromycin are good alternatives in countries with low pneumococcal macrolide resistance. Bacillary dysentery. Bacillary dysentery is a gastrointestinal disease caused by bacterial infection. Symptoms include severe diarrhea, fever, stomach pain, nausea, and vomiting. The condition is most common in developing countries with poor sanitation. Some cases can be life-threatening and require antibiotics and hospitalization. What causes bacillary dysentery? The bacterial infection that can lead to bacillary dysentery are very contagious. The bacteria are usually passed from person to person when fecal matter from an infected person gets into another person's mouth. How is bacillary dysentery treated? Antibiotics, IV fluids, less often blood transfusion. Chikungunya fever. Chikungunya is a virus that spreads to people through mosquito bites, specifically through the Aedes aegypti mosquito and Aedes albopictus mosquito. What causes chikungunya? Getting bitten by a mosquito that's infected with the virus causes a person to get the virus. The virus spreads through mosquito bites, not from person to person, through bodily fluid or contact. This means if you are sick with chikungunya, you won't pass it on to a caregiver or family member. How is chikungunya treated? Drinking plenty of fluids, getting lot of rest, taking acetaminophen for pain, don't take non-steroidal anti-inflammatory drugs, or aspirin until your healthcare provider makes a diagnosis. Cholera. Cholera is an acute diarrheal infection caused by ingestion of food or water contaminated with the bacterium Vibrio cholerae. Cholera remains a global threat to public health and indicator of inequity and lack of social development. Cholera causes municipal water supplies, ice made from municipal water, foods and drinks sold by street vendors, vegetables grown with the water containing human waste, raw or undercooked fish and seafood caught in water polluted with sewage. Treatment: rehydration, intravenous fluids, antibiotics, zinc supplements. Dengue fever. Dengue fever is a mosquito-borne illness that occurs in tropical and subtropical areas of the world. Mild dengue fever causes a high fever and flu-like symptoms. The severe form of dengue virus, also called dengue hemorrhage fever, can cause a serious bleeding, a sudden drop in blood pressure and death. Causes: dengue fever is caused by any one of four types of dengue viruses. You can't get dengue fever from being around an infected person. Instead, dengue fever is spread through mosquito bites. Treatment: you should use pain relievers with acetaminophen and avoid medicine with aspirin, which could worsen bleeding. You should also rest, drink plenty of fluids, and see your doctor. If you start to feel worse with the first 24 hours after your fever goes down, you should get to a hospital immediately to be checked for complications. Diarrhea. Diarrhea means having a loose watery stool during a bowel movement. It's common in both children and adults and usually goes away on its own within a few days. If it doesn't improve or if you are experiencing other symptoms like a fever or bloody stool, reach out to a provider to get in treatment you need. What causes diarrhea? Infections, food poisoning, medications, foods that upset your digestive system, diseases affecting your bowel, procedures on your bowel. How is diarrhea treated? Rest at home. Stay off work or school until you have not had a loose bowel motion for 24 hours. Drink clear fluids or a rehydration solution to replace loose fluid. Take small sip if you feel sick. Diphtheria. Diphtheria is a serious bacterial infection that usually affects the mucous membrane of the nose and throat. Diphtheria is extremely rare in the United States and other developed countries thanks to widespread vaccination against the disease. However, many countries with limited healthcare or vaccination options still experience high rate of diphtheria. Causes. Diphtheria is caused by the bacterium Corium bacterium diphtheriae. The bacterium usually multiplies on or near the surface of the throat or skin. Diphtheria spread through airborne droplets, contaminated personal or household items. Treatment. Using diphtheria antitoxin to stop the bacteria toxin from the damaging the body. This treatment is very important for respiratory diphtheria infection, but it is rarely used for diphtheria skin infections. Hepatitis A and E. Hepatitis A is the inflammation of the liver caused by the hepatitis E virus. The virus has at least 4 different types, genotypes 1, 2, 3, and 4. Genotypes 1 and 2 have been found only in humans. Genotypes 3 and 4 circulate in several animals including pigs, wild boar, and deer without causing any disease and occasionally infect humans. Hepatitis A, also called Hep A, is a contagious liver infection caused by the hepatitis A virus. Some people have only a mild illness that lasts a few weeks. Others have more severe problems that can last months. You usually get the disease when you eat or drink something contaminated by sperm from a person who has the virus. What treatment is available for hepatitis A? Stay hydrated, stay in bed, avoid substances that stress your liver, keep in touch. What treatment is available for hepatitis C? There is no specific treatment capable of altering the cause of acute hepatitis C. As the disease is usually self-limiting, hospitalization is generally not required. It is important to avoid unnecessary medication that can adversely affect liver function. Example: acetaminophen, paracetamol. HIV or AIDS. HIV is a sexually transmitted infection. It can also be spread by contact with infected blood and from illicit injection, drug use, or sharing needles. It can also be spread from mother to child during pregnancy, childbirth, or breastfeeding. Without medication, it may take years before HIV weakens your immune system to the point that you have AIDS. How is HIV treated? HIV is treated with a combination of medicine taken by mouth every day. This combination of pills is called antiretroviral therapy. Taking a combination of type of pills rather than just one is the most effective way to keep HIV from multiplying and destroying your cells. There are also combination pills that have several medications in a single pill. Your healthcare provider will carefully select a combination specifically for you. Influenza. Influenza viruses are constantly changing with new strain appearing often. If you have had influenza is the past, your body has already made antibodies to fight that specific strain of the virus. People with the virus are likely contagious from about a day before symptoms appear until about 5 to 7 days after they start. Children and people with weakened immune system may be contagious from a slightly long time. How is the flu treated? In most cases, you can treat the symptoms of a mild flu yourself. Most people will get better by themselves within 7 to 10 days and without any treatment. Japanese encephalitis. Japanese encephalitis is an infection of the brain caused by the Japanese encephalitis virus. While most infections result in little or no symptoms, occasional inflammation of the brain occurs. In these cases, symptoms may include headache, vomiting, fever, confusion, and anxiety. This occurs about 5 to 15 days after infection. How is Japanese encephalitis treated? There is no specific medicine or treatment available to treat Japanese encephalitis. Antibiotics will not help you recover because this illness is caused by a virus, not bacteria. Strategies to try to relieve your symptoms at home include getting plenty of rest, drinking enough fluid, taking paracetamol to relieve fever. Leishmaniasis. Leishmania parasites are protozoa, one-cell organisms that are too small to see without a microscope. The two most common kinds are cutaneous leishmaniasis and visceral leishmaniasis. Leishmaniasis is a group of illnesses caused by many types of Leishmania parasite. You get it from sandfly bites. It can cause dysphagia